So you think this is going to keep growing in the next 10 or 15 years? Where do you see this idea like a decade from now?
I see it as a decade from now that we're going to have different protocols, different approaches that's going to include plant-based nutrition. So if someone has to go through surgery, they may need to go through a plant-based nutritional detox 2 weeks before going to surgery to improve their surgical outcome. I think plant-based nutrition could be used in the setting of near end-stage life, where individuals who are hurting or having pain or suffering, you can put them on a plant-based nutritional regimen that may improve their quality of life during the end of the years. But I think by and large, plant-based nutrition can be applied at any stage of medical practice and medical intervention. I had a patient, another success story, a patient was on life support, and she was a patient I had been treating for a number of years. She had congestive heart failure, had implanted a defibrillator in her. She also had chronic lung disease. So she was in the hospital with infection. She was intubated on life support, and we were feeding her with a PEG tube. Her kidney started to fail. One of my colleagues talked to the family, wanted to dialyze, and they refused. So she was going to die. So I talked to her and said, look, let me try something. I started giving her raw, freeze-dried veggies through the PEG tube with water. And I took away all the other feeds, and I started weaning her meds. Her lungs started clearing up. She eventually walked out of the hospital. So plant-based nutrition can be applied even in the ICU.
That's incredible. That's absolutely incredible. It's clearly this is an idea whose time has come. Do you think we've reached sort of like the tipping point in this country where plant-based nutrition is just not going to go away? People can't ignore it anymore, you know?
Yeah, I think so. We're either at the tipping point or fairly close to it. I hear so much about it. I'm saying my patient population is skewed. If patients come in, and I'll walk into the exam room and the patient, I'll see the patient, and, you know, my mindset's kind of, sometimes you see an individual, you say, well, there's no way this person's going to want to be plant-based. And lo and behold, they're coming primarily to learn how to get on a plant-based diet. And so, you know, I never cease to be amazed at who's going to follow this program. And so I think we're at a tipping point. If we're not at the tipping point, we're very close, I think.
Well, and it's and to a great degree because of people like you, Doctor, that we are at that tipping point. So I really want to thank you for taking the time to come on and be a guest at the summit. And do you have a website where people can go to find out more about what you do?
Yes, we do. And the website is simply montgomeryheart.com. Montgomery, that's my last name, heart.com. They can also call the office at 713-599-1144. We see individuals not only in the Houston area, the Texas region, but from all over the U.S. And we've had individuals phone in and benefit from our program. So at montgomeryheart.com, there's a lot of educational information that we have. There's an annual conference, health summit that we put on. So there's a wealth of information that individuals can get just from our website.
That's great. Well, I want to thank everybody for watching, and we encourage you to learn more about our efforts to build a Plant Pure Nation at our website, plantpurenation.com.